Assalamu alaikum. My journey in healthcare began when I was around 5 years old. I will take you back to the 1980s for a moment. There is a small clinic in a town called Khammam, which is a few hours away from Hyderabad in India. This clinic is owned by my grandfather, Dr. Sayyid Abdul Majid. He is one of 2 Muslim physicians in town. There are patients who walk miles to get medical care from him. I remember visiting his clinic often. I remember seeing patients sitting in the waiting room, young, old, rich, poor, and often some of these patients would be crying in immense pain, especially young children. At that time, I didn't know exactly what my grandfather did, but all I knew was that he helped these patients feel better and tried to remove their pain. This was my first exposure to healthcare. Like many immigrant children, I was someone born into the field of pre-medicine. And as young as 8 years old, I knew I wanted to become a doctor just like my father and my grandfather. However, while I was in college, I decided to change paths, blasphemous, and pursue an alternate career, still in healthcare, but down the path of public health. It was while pursuing my degree in public health that I was exposed to inequality in healthcare. As Dr. Martin Luther King remarked, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. We are the only industrialized country that does not offer healthcare to everyone. People cannot afford inhalers, blood pressure machines, or insulin. More than a quarter of US adults struggle to pay their medical bills. So 20 years ago, I founded American Muslim Health Professionals, AMP, because I believe all of us, as public health practitioners, physicians, nurses, pharmacists, and professionals from all sectors of healthcare, must work together to address these injustices. The reason why AMP exists is reflected in our mission: to bring together Muslim health professionals and improve the health of all Americans. Through AMP, we are advocating for the rights of minority communities. We are building resources for Muslim-free clinics. We are also focusing our efforts on mental health initiatives, the theme for tonight's dinner. Our Surgeon General, Dr. Vivek Murthy, issued an advisory 3 years ago on the growing mental health crisis among youth that worsened due to stressors from the pandemic. And just 2 months ago, he issued an advisory on the mental health and well-being of parents and caregivers due to the high level of stress. As you all know, suicide is one of the leading causes of death and has increased in the last 20 years. We are witnessing a mental health crisis in our own communities. Recently, I received a frantic email from a grandmother, a retired physician, seeking help for her granddaughter who had a mental breakdown and dropped out of high school. I ran into a pediatrician who said, "Arshia, I'm prescribing antidepressants to children as young as 11 years old. In my entire career of practicing medicine, I've never had to do this." A few years ago, I attended the janazah of a young girl who died of suicide. And I can go on and on with examples. In fact, probably everyone here knows someone who's had mental health issues or experienced a crisis. The demand for mental health resources is growing tremendously. That is why we need your support tonight, to be able to scale our programs and address the urgent needs for our youth, our parents, our families, our teachers, our imams, and our community leaders. As I think of my late grandfather's legacy, which inspired my journey in healthcare, and which ultimately led to establishing American Muslim Health Professionals, I'm also in debt to my late grandmother, Amirunisa Begum, and my father, Sayyid Wajid, for being pillars of support. And of course, AMP wouldn't exist today if I didn't have the support of my family and friends, past and current board members and staff, volunteers, our funders, especially Dr. Munir Chowdhury from Ifanka and Dilnaz Waraich from the WF Fund, and our supporters, that is all of you tonight. In Chicago, there is no shortage of events to attend on a Saturday evening, so I'm personally grateful to you for choosing to spend the evening with us. When the steering committee set the target for 300 to 350 guests many months ago, I knew we can hit it. Being Hyderabadi and living in Chicago-bad, I could have filled the hall with my khandan, but I wanted diversity. And also, to be fully transparent, I didn't want 300 relatives complaining and whining. Khali chicken hai, biryani kyun nahi hai? Only chicken for dinner? There's no biryani? So thank you all for being on this journey of impact for the last 20 years. And with your support, we will continue to make an impact for the next 20 years and beyond to build resilient and healthy communities, inshallah. Enjoy your evening.